What's your name?
My name is Demetrius.
And your credentials?
I am a registered nurse, licensed nursing home administrator.
What is your specialty?
My specialty is risk and compliance.
How long have you been in healthcare?
I have been in healthcare for roughly 14 years now.
What jobs did you have before nursing?
I have always been in healthcare. My very first job was a certified nursing assistant when I was 18.
What jobs or skills helped you the most in your nursing career?
For me, contrary to I think what people may think, project management as well as strategic leadership has helped me the most in my nursing career.
What or who motivated you to go into nursing?
I went into nursing on a bet. I had a friend who was working at a local place for me. My very, very, very first job at 16, right? I don't really count that. My very first job, I was pushing carts at a grocery store. And he said, I'm going to go be a CNA because they pay $9 an hour and we were making $4 an hour. So I said, well, I bet I can do a better job than you. And I showed up to class and he did not. And the rest is history.
Did you consider any other role in healthcare?
I've went back and forth from time to time to if I wanted to become a nurse practitioner. At this current time, I am at a point in my life where I do not want to be a nurse practitioner.
How do you respond to the question, why didn't you become a doctor?
I wanted to inspire the generations behind me and show them that they can do anything that they want to do.
What do you wish you knew or did before nursing school?
Focus more on my younger years of school. There's no secret I have a horrible time at spelling and grammar. And I think that impacts me now, even at the age of 35. I have an issue with spelling. I don't know where the commas go in a sentence. I can't tell you which there, they to use. It just doesn't come naturally to me. So in my younger years, I wish I would have really focused on English grammar and understanding that.
Where did you go to school?
For my LPN, I went to Next Care. It was a school inside of a nursing home in the basement in Westland, Michigan. For my RN, I attended Jackson Community College. That was an LPN RN transition. For my bachelor's, I went to Ohio U. For my master's, I went to Aspen University, as well as for my doctorate, Aspen University.
How did you pick your schools?
Cost. Cheapest, quickest. So when I was 18, or when I did my LPN program, I could not get into an RN program. I was discouraged. I was beat up. No one would let me into an RN program because I couldn't pass the English proficiency tests. Although I was able to speak appropriately, once again, as I mentioned, I couldn't tell you where a comma went in a sentence, when to capitalize a word. It just wasn't my forte. I'm better now, but it wasn't my forte. And I heard of this program that said, we don't care how your English is. We don't care what your test scores is. You have $15,000 cash, you can become an LPN. So I went to that school, and that kind of started my journey as a nurse.
Did you shadow anyone before pursuing nursing or your specialty?
I was a CNA, and I was working with other nurses, and I got to see what they were doing. And if I must be truthful, as a CNA, I thought the nurses did nothing but sit at the desk and chart. So I said, that sounds like a great job. I'm making $9 now. I can go be an LPN and make 25, and I just have to sit down and have to do absolutely nothing. So that's why I converted.
What motivated you to advance your education?
Could you repeat the question?
What motivated you to advance your education?
Money. Especially from LPN to RN, it was money, because here it is, I was making 23 and they told me if I go back for 9 more months, it was just a return on investment. I'd make 35. So you're talking about 9 months of my life, I can make an additional $10 more, and possibly even more now that more opportunities are coming my way. After I got to RN, what motivated me to go from to a BSc and an MSc was just advancements in titles. At one point in my career, I was chasing titles, was really wanting to be a chief nursing officer, chief executive officer. And it's interesting as I got those titles, I wasn't more fulfilled. I just had a title with more work, but I wasn't fulfilled. So now as I advance my education going to the doctoral realm, I'm looking at giving back to the generations behind me.
Did you receive any financial support or tuition reimbursement?
No, I've never received financial support. One of my issues with tuition reimbursement is I'm married to the organization once you give me that money, and I'm probably advancing myself at the time. Young me thinking, not me now. I was probably advancing myself at the time so I can advance out of this job. So I never saw. I never accepted tuition reimbursement because I did not want to work anywhere after I got that additional schooling.
Your strategy for paying back student loans, if you have any?
So I've always paid cash. So for me, I looked at the ROI or return on investments. So there was a period of time where knew I was going to go to school. So I would fund heavily my 401k, a very strategic move. I'll fund heavily that 401k the year before. And then when it's time to go to school, I would take a loan for myself out of the 401k. And then I would pay my own loan back with interest in that 401k. So although while it was a loan, to me it was a smarter way of doing a loan because I paid myself back, and I even had to pay myself back interest because I pulled from my 401k.
Wow. Advice for nursing students in clinical rotation and orientation?
Ask questions. Don't think you know it all. Nurses will be mean. Nurses will attempt to eat their young. That's not how the whole world operates. So when somebody is not being nice to them, nice to you as a student, you take it with a grain of salt, but never give up, never quit. There's a reason why you chose this wonderful profession.
What's one thing you think students should know about nursing that's not taught in nursing school?
That when you get out, you're going to have more than one patient. Because when you're in nursing school, they give you one patient and one disease process at a time. And when you get out, you're really focused on holistic care of multiple patients, depending on the setting. Let's take LPN, for example. You have 4 max, but when you get out in the real world in long-term care, you got 24. At the med surge level for an RN, they're going to give you 1, 2, maybe. But when you get out there, I've known RNs to have 6, 7, 8 patients. So, know that this way, while it may seem easy, it may get a little bit challenging once you step outside of those classroom doors.
What, if any, changes would you make about nursing education and training?
Get rid of those fake care plans. Who's looking at them? So when we talk about education and planning, I think we just got to be realistic about what's going on. And I joked about the care plans, but I think what's really realistic is for us to, once again, care plan multiple diagnoses as best as we can at one time versus, walking through the students with a care plan and showing them how to fill out a care plan, but they're using these old books and they're not, it's not realistic. I think what's wrong with technology and schooling is we're so far using, we don't allow using students to use technology. They have to get it out the mud. But when they get out in the real world, it's click, 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 click. Why can't we show them what it's really like to inspire and motivate them? I know me particularly, I used to have to carry around this big old care plan book. I remember telling my nursing friends I had a care plan book, and they would look at me and say, yeah, you have to do it for the class. But when you get out there in the real world, we don't have a care plan book. We're going to do this, 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 this. And I think that for me, that was a demotivating factor. I remember I did a care plan in fundamentals, and the teacher wrote big F right over it. And it was just like, it just wasn't realistic because who's really using this? And I know that now as a person out in the field, but as a student, it almost ended my career.
When and how did you get your first mentor?
For me, I've had plenty of mentors over my life, and they're generally people who are older than me, who I lean into for strength and guidance. So I don't think that I've ever been at a point where I've said to somebody, hey, can you be my mentor? But I've always aligned my people with people who are there who are going to support me to be my best self.
Advice for how mentees can add value to the mentor-mentee relationship.
I think for me as a mentee, as I talk to people who are identified as a mentor, who I can get information from, I think it's about being open. And when you say adding value, I think it's a challenge for someone who maybe not know anything to sometimes add value. But what you do know, I think you should bring to the table and have an open mind when you're receiving that feedback. Don't be afraid to push back ever so gently, but also, be open and honest to the feedback that they are receiving.
What specialty did you think you were going to get into at the beginning of your journey?
I think getting into my journey as an LPN, it was just going to be bedside nursing because you're told you're always going to be at the bedside. You're an LPN. As I advanced my career and got my RN, it was definitely going to be leadership. I couldn't just sit at the bedside. I wanted to advance the field of nursing. So once again, as I started, it was bedside, but as I transitioned and gained more knowledge, it was definitely leadership.
What attracted you the most to your current specialty?
Making change. So when we talk about leadership, it's about making change. And I wanted to be a voice for the people who are voiceless. There's so many of us nurses that are afraid to speak up. We're afraid to challenge the status quo because we're afraid of what's going to happen to us at our job or how people are going to view us. That's where I come in. I wasn't afraid to lose a job, and I wasn't afraid for people how they were going to view us. What I was afraid of was the lack of care these patients were going to get if we didn't change the way that we were operating as an organization.
What deterred you from some of the other specialties?
Really, it was only two specialties that I was like, that's probably not for me, and that was OB and peds. Especially at the time when I became a nurse at 21, I didn't have kids. I never changed a diaper. I didn't even hold babies. So for me, I was very deterred from that. And I think to this point, even though I have a daughter, I don't think I would do OB and peds. I'm not all cute and cuddly as I think you should be to be that particular nurse. So for that, I have kind of stayed away from anything that has to do with OB and peds.
How would someone know if they have what it takes to be in your specialty?
So my specialty is leadership again, and I think that leadership can be learned, but it's also a lot of on the job experience. You have to get people to follow you when they otherwise wouldn't follow you. You have to get people to change their views and their perception. So when you say how would you know, I don't think that this is something for you. Leadership to me is more of a calling, but I think you should know if you're not a good leader, right? If you're looking at the data and it suggests that hey, your staff is turning over hand over fist, right? People don't want to come to you. People don't want to interact with you. Maybe that's some signs that you should not be doing that. But from the other perspective, when we talk about leadership, once again, it's to me, it's a calling, and you have to just be there and make those tough decisions and learn and grow from those tough decisions.
Who should not enter your specialty?
People that's closed-minded, people that want to run the show and not listen to other people, which means they're closed-minded. And I think if I'm being honest, um, people who have not done the work. I think what irks me the most is when people just get a degree and they automatically advance to that title, but they don't know what it's like to work the floor. They don't know what it's like to go through some of the struggles that we've gone through. So when they're making a decision, they're thinking from a one-track perspective. They're not open to hearing other people's perspective, and that often hinders the environment.
What does continuing education look like for you?
I am a career student, my wife says. I am always in school. And so for me, continuing education means continuing to grow and gain additional skill set and knowledge that I currently do not have. Currently, I'm finishing up my DNP, and then I have plans from there. Don't tell my wife. To go back to school. I'm looking at two different areas, and this is going to continue my education prospect. But I have two different areas that I'm looking to continue to grow in as a nurse.
Mm, 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 mm. What does what does professional development look like for you?
So professional development, I think, is different than continuing education. When I said continuing education, right, to me, as you saw, it focused more on the educational components, the scholarly components. But professional development is me attending conferences with like-minded people who are doing something the same or similar to what I'm currently doing, and who can provide a different perspective to how I'm doing things, and who can challenge the way that I'm thinking. So when I talk about professional development, I am reading journals, I am attending conferences, and once again, speaking with like minded people who challenge my thought process.
What does networking look like for you?
Networking for me looks like what I consider networking, I would say, is speaking with people in and outside of your area and really just being open to their thoughts and their perspectives. So for me, I utilize LinkedIn a lot. That's how I meet a lot of people. I live in the middle of the ocean currently, as I've stated, right? I live in Hawaii. So for me, I have to network. So I have to rely on social media such as Facebook, such as LinkedIn to connect with like-minded people that look like me or may not look like me. I think that's what the joy of networking is. You can network with a diverse group of people from all walks of life and hear their perspective and share your perspective.
Where did you learn how to negotiate?
My dad taught me how to negotiate. He doesn't pay full price for anything. He's at the dollar store negotiating right now, and it is called Dollar Tree. I don't understand it. You knew what it was when you came in. So he taught me how to negotiate, and from there, it's just grown into this whole thing that I do now as a negotiator.
How, if at all, has your nursing practice affected your relationships?
I don't know that it's affected my relationships completely because I've been in healthcare so long and it's all I know. I don't know anything else. I think from a joking perspective, my wife thinks I should know a lot more than I know. I have to remind her I'm not a nurse practitioner and I'm not a nurse at home as much as she thinks I am. So I know it may sound funny when I say that, but um, I think from what it is, all I know is healthcare. So I don't know that it's impacted any of my relationships.
How many hours do you work per week?
I work 40 hours a week, sometimes more, depending on the assignment. As a healthcare consultant, my current role is I have a dedicated 40 hours a week, and then depending on the other projects that I'm working on, so it can range up to 50 hours, but I'm usually right around 40.
Do you work nights, weekends, or holidays?
At this time, I do not work weekends. I do not work holidays. So my primary focus is Monday through Friday.
On average, how many patients do you see in a day?
So I work currently as a healthcare consultant. So I do not actually physically see patients. I help organizations such as hospitals, post-acute care, assisted livings, home health fix their operational and clinical issues. So when I'm coming into an organization, I'm going to help you see more patients by streamlining your processes and eliminating redundancy.
What's your typical day look like?
So typical day for me is a few meetings, interacting with stakeholders who oversee different departments, different projects. And as a project manager or healthcare consultant, I really help them move that needle forward. You'll hear me say that multiple times. If you're here for me for a day, I want to help you move the needle forward. So we may have a project and we have a deadline, and it's my goal to help you reach that deadline and achieve that project on that deadline or hopefully before that deadline.
How much time do you spend on charting?
So once again, my particular role is a healthcare consultant role. So I don't have any particular charting that I'm doing, but I do have documentation that I'm doing for the projects that I'm working on. So for me, I can spend anywhere from 30 minutes to an hour a day doing documentation.
What's the most common advice you give to your colleagues?
The most common advice I give to my colleagues is to take time for yourself. Have a work-life balance. We can get ingrained. I don't care if we're a nurse, healthcare executive, we can get ingrained in what we're doing and we fail to take time for ourselves. And if we don't take time for our mental health, no one else will. And we will suffer. And if we are suffering, we're not showing up to wherever we are, whatever space, whatever environment at 100%.
What's your most memorable patient encounter?
It was um most memorable patient encounter. I had a patient sign himself out AMA against medical advice, go out and have a night on the town, show back up as if we were going to admit him stumbling into his room. So we had to have security escort him off the premises because he was like, "Oh, I just went out and I should be able to come back." And I'm like, it doesn't work that way. Once you sign out against medical advice to go have a night out on the town because it's the first of the month your check is hit, you have signed out. Well, I didn't know that. Nobody explained it to me. And we get to show him his signature of what he did sign. And, we got him back again because he just goes to the ER and comes back to the floor. But to me, that was very funny to see this particular patient stumbling out of a cab. as if it was normal for him to be able to do that.
What's been your most challenging patient encounter?
For me, anybody who's on hospice, I specifically have not in the past worked hospice because I didn't understand death and dying. It wasn't until my auntie passed away in 2014 that I had my first real death that was close to me. Um, I think at that point I might have been 25, 26. So it was a blessing to make it to that age without death or dying. And it wasn't until that time, like I said, then I understood what death was, and I became honored to be there. Somebody is transitioning, but it's still always a challenge, right? Because this person is transitioning. This person is leaving this life, and sometimes I'm the only one there. I'm the only nurse there. I'm the only friend, confidant that they have there who is holding their hand as they take their last breath. So I had to learn to get over that and learn that it's an honor and a privilege to be there, but that is still one of the most challenging things for me to do as a nurse.
What's the toughest part of your job?
I think the toughest part of my job, and once again, I say I work as a healthcare leader, healthcare consultant, is to corral people to understand a mission and vision. I think that as a leader, we have to get our team members to understand the mission and vision of the organization and why we're doing what we're doing. And what that means is you have to work with people not to have their own hidden agendas, but to come to the table and understand the agenda and the agenda and the focus for the organization. To me, that's a challenge. Is once again getting people to understand the mission and vision of the job and really move towards acting out and carrying out that mission and vision.
What's the most rewarding part of your job?
Seeing processes come together and seeing patient outcomes improve. I love patients. I love everything about healthcare from the standpoint of, when a patient comes to us, they're at their worst. Nobody's going to see a nurse, a doctor because they want to be there. Not one person is signing up to just walk in and get a set of shots and get in the physical. But when I can put a process in place that streamlines their process, that improves their patient experience, that excites me most.
What's your best clinical skill?
This gift of gab. Because it is a skill. It is an art to be able to connect with people on different levels. When I walk into your room, many people have white coat syndrome. Many people are afraid of a nurse. Here it is. This big random black guy coming into a room. But I get to use this gift of gab to get you to lower your guard and understand what I'm saying. I get to use this gift of gab to speak to you at a level that you understand. So sometimes I need to speak to you and say, "Hi, I'm Demetrius. I am your nurse, and I'm here to talk to you about your hypertension." This gift of gab also allows me to do this. "Hey, I'm Demetrius. I'm your nurse. I'm here to talk to you about your high blood pressure issue. You can't keep eating that salt. It's just not good for you." I get to use this and adapt it to where it needs to be so that way the patient has the best outcome.
Who are you most grateful for on your care team?
I think on any care team that I'm most grateful for is a supporting manager. And I think people may say a supporting physician. To me, a supporting manager, because I know that if I have an issue, I can go to someone and they can be a resource for me. They can be a sounding board for me. They may not be able to fix the problem, but they're going to listen to me explain the problem and listen to me vent. So anytime that I have a resourceful manager or resourceful leader who's there to support me, I'm grateful for them.
Do your friends or family ask you random medical advice?
Not anymore because they know I'm not qualified to answer because my answers are not good.
So I guess you don't give unsolicited medical advice.
Oh no, I don't even identify as a nurse. No. I when I show up at an accident scene, I say, "Hey, I'm trained in first aid and CPR." That's the thing that you got for me. I have no medical advice because what happens is, to your point, right, it becomes unsolicited, and then some people take it as the gospel, right? And you should always be going to a trained medical provider or a trained provider, such as a nurse practitioner, a physician assistant, or a physician. As a nurse, do I know information? Can I interpret your labs? Can I pretty much tell you what the doctor is going to say? Yes, but in this day and age, I kind of limit what I say, and even to the family and friends, right? I'll help you interpret, and I'll even be in a room while the doctor's sharing the information or the provider's sharing information. But I try to reserve my judgment and allow you to gather the information and the facts and help you come up with your own conclusion to whatever it is you're asking.
Do you ever get nervous or anxious? If so, how do you manage those feelings?
I recently just started to develop anxiety, and that came after my mom passed away in 2022. I never had anxiety before. How I manage it now is I'm learning to learn what's triggering them and what's triggering the anxiety attacks or pseudo panic attacks. And uh, I think based on me learning what's going to trigger it, I can better manage it. I'm not 100% there yet. I don't physically talk to a therapist, which I probably should, but I think that for me, it's identifying what's causing me to have this anxiety or what's causing me to have a panic attack. It's going to be key to me managing it.
What are your hobbies outside of your practice?
I have a 6-year-old who will be turning 37 soon, and she dominates my time and tells me what I can do and can't do. So currently, my hobbies are going to Chuck E. Cheese, going to the Fun Factory, and I'm going to Lucky Strikes every Wednesday.
And is that how you spend your days off?
That is, I am an active dad. I am an involved dad. I am a Black father who is there and who will continue to be there. So, you know what? I'm going to spend my days off with her because I can't get that time back. And, for a better part of my life, I did not have that time. So my daughter will know what it's like to have an involved father.
Wonderful. Who do you go to for help?
I have different people, as I mentioned earlier, for the mentor question. It depends on what I'm looking for. I have somebody who I will go to talk finances. I'm going to go to somebody for health advice. I'm going to go to somebody for spiritual advice. But one of my number one advisors is my CEO, my wife, who's been with me since I was 16. We started off as high school sweethearts, who's been with me more than I've been alone and not known myself. Right at 16, I'm 35 now. So my number one advice giver is my wife. Although I will challenge everything that she says coming out of her mouth, I do listen and I do take the feedback. Not in front of her though, but I do listen. I do take the feedback and then incorporate it. And she'll know that it's that I've listened because she will see it in my action. But I'm not gonna tell her right there. I'm not gonna give her that satisfaction.
One thing you're afraid of?
Failure. It's no ifs, ands, or buts. I'm afraid of failure. I'm afraid that I will not be enough. I'm afraid that I would not have set my family up for success when I depart because we are all in a dying process. So one of the things that I'm always harping on, and probably this doesn't sound good to a 6-year-old, is preparing my daughter and my wife for my untimely departure. But I'm more afraid of departing and they not having the skills to do what they need to do to continue the mission forward.
Coffee, tea, or soda?
Cold coffee.
Scrubs or no scrubs?
You can't see it right now, but I'm wearing scrub pants right now. All the time, but I don't even treat patients. So comfortable. Scrubs.
Are you an introvert or extrovert?
I can be both. Most oftentimes I'm an extrovert, but there's times where I'm just alone into myself, even in a room of people, right? I'm watching, I'm observing, and then I'm an extrovert once I figure out where I'm aligning.
Do you think there are more introverts or extroverts in your specialty?
Extroverts.
We're hanging out for the day. What's on the agenda?
Always food. That's why I'm so big right now. So big. Always food. And then for me, if we're heading out, it's going to be hitting the beach. I love to snorkel.
How many hours of sleep do you get on average?
5.
When does your day typically start and end?
5:30 in the morning, roughly about 11:30, 12 o'clock at night.
If you weren't in nursing, what would you do?
I'd love to be a lawyer. I love arguing. Oh my, it's my favorite pastime. I would love to be a lawyer, and to be in a courtroom.
So you're a little jealous of your brother.
Well, Jeremy is not a lawyer. Jeremy, who's my
He
brother.
thinks he is, right? He thinks he is.
Shout out to my brother. He just finished up his doctoral degree in criminal justice and counterterrorism. He does not know what he wants to do with it, but he has that degree. So yes, shout out to him.
How much longer do you think you'll practice?
I don't have any other qualifying skills in life, so I have to ride my one skill that I figured out how to do, which is healthcare, until the wheels fall off. So I'm 35. I would love to ride this till I'm 60 and be able to retire. And reason being is, and when I say retire, right, maybe I'm not full time in this, but I'm teaching somewhere. I'm on the beach doing a remote class somewhere. I'm hired just strictly as a consultant, no real hands-on work. But I think what happens is we try to work so long, and we try to, because we have to, right, for medical reasons, for financial reasons, right. But I really want to set myself up so when I'm 60, I can travel and see the world, and I can do what I want to do on my time.
What should someone who's considering nursing do to prepare now?
Just do it. If you want to do it, just go down to the local community college and sign up. Just do it. I think that there's two avenues into nursing. As I always tell people, there's RN and the LPN way. If you cannot get in as an RN, there's always an LPN program out there with their door open. You got $15,000. They're going to let you right in. Don't take no for an answer. So if you're preparing to go into a nursing program, don't take no for an answer. I tell people all the time, when I was trying to get into my RN program, I remember going to the dean and I was like, hey, I want to go and get into this program. She said, unfortunately, you can't pass this test. You're not passing this test. And if you're not passing the test, you probably don't understand how oxygen flows and all of that good stuff. And I used that as motivation. I went right over to the LPN program. And a year later, I was a nurse. And I walked back into her class and said, hey, into her thing and said, hey, you remember me? She said, no, not really. I said, well, just to let you know, I became that nurse that you told me I couldn't become.
How has your experience in nursing changed the way you see the world?
I see the world as strictly as a business, and the reason that I say it like that is I got into healthcare thinking I was here to help people, and I'm here to help people, but I learned that the world is a business. Even healthcare is a business. You're coming in as a nurse, fresh face, bright eyed, bushy tail, and I'm like, I'm here to do this, and then I get there and realize we don't have a bladder scanner. I don't even have calf kits. I have to make it right. They're operating from a business perspective. Healthcare is just a byproduct. They're in it to, depending on where you are, in it to generate revenue. And for me, this is why I got into leadership, because I wanted to go and change the narrative. Yes, we can make money, but we have to give the nurses what they need to be successful. So if I'm working in an organization, I'm going to give you the tools to really calf the patient. You shouldn't be in there trying to figure out how to make a calf kit. You shouldn't be figuring out that you need to make an IV start kit. So for me, over time, my views of healthcare have changed because I've realized it's a business first. We care for the people second, unfortunately.
What's your perspective about the current state of healthcare?
I think we have a lot more to do. When I look at other countries and I look at their healthcare, they're so far advanced. I'm happy for where we are currently, but I think there's a lot more to do to get healthcare equity and equality for all. I think that's a challenge, right? Just because I have revenue or I have, just because I have money, I shouldn't have access to that cancer medication, and you don't have money, so you don't, and you're just going to transition. I think that is something that as a society we need to work on.
What's one thing you would change about healthcare?
I think it's similar to that. For me, healthcare should be accessible to all. I think that there's too many barriers to healthcare and to quality healthcare. And I think that because there's barriers to healthcare, we have a lot of health disparities throughout the U.S.
Is healthcare a right or a privilege?
There it is. Is healthcare a right or a privilege? I think if we're like the rest of the world, we're gonna say it's a privilege. Just like everything else in the world, it is a privilege. Unfortunately, I think that's where the world is at. It's a privilege.
What changes are taking place in your specialty as it relates to clinical practice and in research?
So in my specialty, and when I'll dive a little deeper, I focus primarily on post-acute care. And one of the things that are changing in this area is we have just received earlier this week staffing mandates which is going to improve patient care across the U.S. It's also going to be detrimental to organizations who cannot afford to hire on the additional nurses and support the mandate. So I think from an operational standpoint, it's going to potentially harm the industry up front. But from a clinical perspective and from a patient center perspective, kudos to those patients who are now going to have more access to healthcare providers to them, right? We have officially put in some nursing standard ratios.
What do you want the public to know about nurses?
That we are people too. And I understand that you're ill, that you're sick, but it does not give you a right to talk to us like second-class citizens. And it does not give you a right to put your hands on a nurse when you don't agree or you're feeling the way that you feel. It's never okay to hit or verbally abuse anyone. And it's never okay to use your illness or sickness to say, oh, I'm sorry, that was just, I was at a bad place. Nobody deserves to be abused because you're in a bad place.
If you had one more hour in the day, what would you do with it?
If I can squeak out one more hour in a day, I will give it to my daughter and spend time with her.
What's your opinion of healthcare professionals using social media?
I think there's a place for it. I think social media has a place for everything, and I'm one. I use TikTok. I use different platforms as well. So I'm a fan of social media. I think it shows the world what it's like to be a healthcare professional, depending on what you're using social media for. So I'm for it.
What did you think you were going to be when you were a kid?
I have a video of me at 6 years old saying I was going to be a lawyer. So at early age, I thought I was going to be a lawyer. When I graduated high school, I had, with a 1 GPA, by the way, I had a chance, long story short, a chance to go be a computer engineer. So I went to, I think, the orientation and I never showed back up.
What advice would you give your younger self?
I think I would give my younger self to not be so serious. I think that I have a strong personality, and sometimes that cannot be well received by others.
What would you do if you could do it for free?
DJ.
What can we expect from you in the next 12 months?
The next 12 months for me to be very close to finishing up my doctoral degree in the next 12 months. Next 12 months, you can expect to see me more out and about on social media, my podcast out and about doing things, and me attending more conferences and networking with people across the U.S.
What advice would you give the aspiring healthcare leader who's married with children?
Ooh. I don't think that impacts you because there's various stages of leader. And I think when we talk about leader, we fail to realize that, right? There's a supervisor, there's a team leader, there's a manager, there's a director, there's executive. You just have to understand where you want to land, and based on where you want to land, know that work-life balance sometimes can be impacted. So it's very important that you share with your spouse, with your family, your goals, your visions, and why you're doing it, to get them on board and respecting your decision to move that needle forward. So once you have your family on board, it becomes a lot easier versus you just, putting your head down and milling through the sand. So I think that my biggest advice would be for you to just make sure you incorporate them in your decision-making process as you try to enter into healthcare leadership.
The best 3 decisions you've made.
3 decisions?
Yep.
Yeah. So one of the best decisions I made was I upped and moved to Hawaii, stepped out on faith, believed in myself, proved that it can be done, that I can make it from Detroit, Michigan to Honolulu, Hawaii without knowing anyone and making it, do what it does. The second advice, or the second biggest decision that I've made in my life that has paid off tenfold, was accepting that I was going to be an LPN when I couldn't get an RN school. There was a time where I did not want to be an LPN because I thought they were little play nurses, little pretend nurses. boy, was I wrong. LPNs are real nurses. We work hard. And the third thing that I did, the best decision in my life was marry my best friend.
All right. I was waiting. I'm like, he's got 3 shots. One of them.
Marry my best friend. Stephanie has been my ride or die since I was 16. Back when I had that one GPA, she saw something in me. And I always tell people, right? I remember, signing up to go to community college, and she said, if you want to be with me, you got to be something. And I was like, whoa, 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 what does that mean? So she said, you got to go to school, you got to figure it out. You can't whoa in your one GPA. And I remember looking over to her and saying, hey, if you want to be with me, you got to be something, and you can't go to school to be an art teacher. She was going to be an art teacher. And so we compromised, and she changed her major and became a math teacher, loves what she's doing. And I actually won, right? I got her, and I went to school and became a nurse. So, I think I definitely, that was probably the best decision, because without my wife, I probably wouldn't be here on this podcast.
Okay, last question. And this is a fill in the blank. My nursing legacy will be.
When people look back and think about my nursing legacy, I want them to look back and say, Demetrius was a champion for inclusion, compliance, and risk management. And what that means is I want people to look back and say, Demetrius bought whoever could do the job with him to make sure that organizations was compliant and mitigated their risk and put patients first.
Demetrius Kirk, DNP student, we thank you for your time.
Thank you.